and look at your symptoms, see what's going on, see what we can gauge from your old studies, and then determine what to do next. Typically, if it's been a while since you've had your last MRI and your symptoms have progressed, or there are new symptoms added to the mix, then I get a new MRI because you don't want to miss something new. Okay, one more question there, yes?
On the spondylolisthesis, what's the more conservative treatment, because you don't really get rid of it if that cartilage is ruined? Is there, can people exist a long time?
Okay, in terms of when you say you don't get rid of it because your cartilage is ruined, what are you referring to in terms of the disc being slipped? So there are several ways to skin a cat, but basically there's different ways you can treat this problem, right? Typically, it depends on how degenerated you are, but you may remove the disc, okay, and put an inner body graft in between the two bones in order to heal that when you do the surgery, because it's an additional area around which to get a fusion, okay? When you treat something like that, the main problem there is instability. The secondary problem is nerve compression, okay? So you want to treat both. So we take the pressure off the nerves and then we stabilize the spine with screws and rods. When you stabilize, you're trying to get a fusion to grow. That's not the easiest thing in the world to do. So we try to utilize as many areas of surface that we can to gain that fusion, one of them being the space between the bones. Okay? When you talk about conservative things, well, conservative treatments or modalities still fall under those three basic tenets: anti-inflammatory medications, physical therapy, and epidural injections. The epidural injections tend to target the leg pain component of it, not so much the back pain. There are other injections that you can get, things like facet injections, that try to target the back pain. But if you've got a good reason for why you have pain, such as instability, it's probably not going to go away in the long run with the facet injection. It may go away temporarily.
I have a quick question.
Yes.
In one of the earlier slides, you showed a diagram of the spine with cartilage, and you showed the difference on the screen between healthy cartilage and cartilage that was worn out.
Yeah.
And you mentioned that it was well hydrated.
Mm-hmm.
Is there a way you can keep your cartilage hydrated?
Yeah, that's a golden question, right? So the way that the disc is made up, so the center portion is the nucleus, the outside is the annulus. The nucleus contains hydration, or has water, is the layman's way to describe it, but it has liquid within the center portion of it. So if we could keep that liquid within the center portion of it, we would maintain the shock absorbing properties of the disc. The problem is, over time, that goes away. You lose hydration. The disc desiccates or dehydrates, okay? So no, that doesn't exist right now. There are trials or sort of research into doing artificial disc replacements, but the problem is the same for artificial disc replacements versus anything else getting into the disc, putting water back in the disc, is you have to get to the center. But to get to the center, you have to break through the rings. If you break through the rings, you potentially disrupt the structure. So it's definitely being researched. There have been nucleus replacements that have been developed. I think they have tried them in some human trials so far, thus far, but it's not yet in clinical use.
Thank you.
Sure. All right. Yeah, there's a stack of them over here.